Okay, thank you very much for the opportunity to talk, and I appreciate the fact that on Sunday you are listening to webinar instead of being with your families. So, so thank you very much. So I'll try to be short because I think that many of the things are well known to everybody in the crowd. Actually, following patient is very costly and challenging. Once you step out of the hospital, basically nobody have a clue what is your situation or what is your condition, and it's very costly, and of course, in many cases, case damage as well. Budget is not equally spreaded. We can see that 20% of the population is consuming 80% of the budget. This is in the US. I believe it's the same every place. Many chronic disease patients, many elderly population are really needed more treatment and more budget than young and healthy person. And the fundamental problem is basically that the doctor and the physician doesn't have any information about the patient, so they miss the opportunity. There is no rapid action and the inability to provide service. So basically, if I'm looking on a world that we all know, I believe that nobody will buy a car today without a dashboard. Assuming that you buy a car and you have a speedometer, every 10,000 kilometers, you have to go for a maintenance in the garage, or if you see smoke coming from the engine. This is the way that our body is treated. You know, you are going to doctor check or physician check every 3 months, 6 months, every month, or if you feel pain, which means engine coming, smoke coming from the engine. So this is the way that we are working, and we want to change it. The current approach is very limited. There is a spot check measurement that you measure once a day, twice a day. There is a chest patches that are good for a few days. And there is also analytic tools, but they are not connected to the sensor. So basically, they're missing information. And there is a lot of equipment that people can have at home, starting from ECG, glucometer, or pulse oximeter, blood pressure, but all of them are taken after you feel bad or once a day, and they are not connected. So what we try to do is basically try to make all this process much faster and reliable. So we came out with a solution that, starting with a device that looks like a watch, sitting on the wrist of the patient. It's a medical device, a medical grade result, measuring multiple parameters. I will elaborate on it. Transmit all the measurement by Bluetooth to a smartphone application or tablet, and from them to the cloud. So basically, the patient is connected real time, all the time, 24/7. And so we have all the system in place: watch, application, cloud, and the cloud can be connected to a call center if something happened, and it's connected also to a artificial intelligence power portal that can analyze the result and set automatic alarm. So what are the parameters that we are measuring today? We are measuring oxygen blood saturation, pulse rate, which together is pulse oximeter, heart rate variation, motion, activity, steps, sleep pattern, skin temperature. We are adding now on these days respiratory rate, and later on fall detection. All these parameters are measured without any patient intervention, every 1 second. So the patient is wearing our device 24/7. We are taking measurement every second and upload everything to the cloud. So actually, we are changing the way it's measured today from a fingertip device that the patient putting once a day or twice a day that doesn't work when you are moving, with something that the patient is wearing 24/7, and the measurement is connected, is comfortable, and we can detect now trends and events, because instead of measuring once a day, once you measure every second, you can see that something drop down, something go up, there is a trend, you can identify it, and you can really generate automatic alarm. And that's what we are doing. So we are changing the RPM that existing today, what people call telemedicine from time to time, from episodic spot check, offline, post-event normally, with something that is continuous, precise, accurate, real-time, and automatically. So the parameters that we are measuring are on the right side. You can see a lot of parameters, and you can get to different conclusions based on this parameter that a physician can be able to really take decision based on these parameters. So our traditional end user was COPD patient, people that are suffering from pneumonia, heart failure, CHF, respiratory problem, sleep apnea, which normally needed to measure oxygen on the blood, but nowadays no one can give a presentation about relation to COVID-19, and we all know that in COVID-19 patient, the most important parameter that can detect that patient is deteriorate is measuring oxygen blood saturation. So once a patient is identified as a COVID-19 patient, before he's going to hospital, normally he's sent to quarantine or to isolation, and that's the time that he can get our device. And once the situation is deteriorate, and it's happening suddenly, we will detect that oxygen drop down, and we will ask him to come to hospital or to be to take treatment. We all know that people with background disease like COPD, CHF, and diabetics are the most vulnerable people, and we are treating these two. What we also can see is that many of people that are recovered from the disease still have lung malfunction, and they need to be monitoring for weeks, for a month, nobody really knows, and we can help in this stage as well. So basically we supply smartphone applications that which can show you the current measurement, last hours, you can have a care plan, fill up a questionnaire, everything is going to the cloud. And once your physician will look at the cloud, he will get automatic alarm when something goes wrong. And also, you can see on the top of the line, the one that situation is becomes severe. And you can zoom in to any of the patient and see all the parameters of this patient in the last hour, the last 2 days, the last week, and see if it's only one time measurement or it's something that started a few hours ago and need to be treatment, and you can take an educated decision what to do with this patient. So this is something that collects the information, but once we collect the information, we can apply now AI mechanism, and we are trying to be now automatic baseline per patient. You know, every patient acts differently. So we are building automatic baseline, personal baseline. And then basically we can detect if something go out of this baseline, and we can apply more sophistication. For example, there is a correlation between different parameters. For example, if a patient is very active, heart rate go up, no reason to put any alarm. But if a patient is not moving, heart rate go up, saturation go down, he's going to have exacerbation very soon, and this is severe alarm. So basically, by looking at multiple parameters coming on the same time from the same area, we can get to much more meaningful alarms. We have FDA, we have CE, our cloud is complied with GDPR and HIPAA for the US. It's unique technology protected by patents all over the world. And basically, we are the only company in the world that succeeded to do measurement of oxygen blood saturation on the wrist instead of the fingertip accurately. So this is a quote that I like to use. If we have a data, let's look at data. If all you have is opinion, let's go with mine. So I think the data reliable data, accurate data, and analytic is the key to keep patient safe and living normal life at home. Thank you very much.